Everybody, it's Dr. Lisa. I have a special guest today. I have Dr. Taison Bell, who's going to tell us a little bit about what's happening in the hospital. But how are you doing, Dr. Bell?
I'm doing all right. Another day is another day the Lord gives us. So I'm just happy to wake up and be able to come to work and do what I need to do to try to fight back this pandemic.
Yeah, tell us a little bit about yourself so people understand your background.
All right. So I'm a critical care physician primarily. I work in the ICU at the University of Virginia, where I'm the director of the medical ICU. So that's where we take care of COVID-19 patients. I actually did an infectious disease fellowship, so I'm trained in infectious diseases and in critical care, which makes kind of the pandemic really, a coming together of some of the skill sets that I have. So I do a lot of clinical care and then a lot of outreach around COVID-19 because what we're seeing in the ICU is at this point, luckily, is preventable, but we have to be able to get folks comfortable with taking a vaccine to, keep them out of the hospital.
And it's so rare to find someone who is trained in both ICU or intensive care medicine and infectious diseases. So this pandemic is your sweet spot, it sounds like.
Unfortunately, when people want to talk with me, it's because bad things are happening. So that's my joke, but it's really true now that even people reaching out to me, media outlets to talk about this, it happens when the pandemic is getting worse. And so I can kind of tell when things are going bad throughout the country, and because people are starting to reach out and want to talk a little bit more. So, it's a busy time for me, which is, unfortunately a bad thing.
Yeah. Tell us what are you hearing from patients?
Well, the patients I take care of, they're already critically ill.
Mm,
So, at this point, what I often hear, if the patient's able to talk, of course, is a lot of regret. I think there's so much misinformation out there about how dangerous COVID-19 is, or the misinformation that it's not that big of a deal, that the vaccines are either not safe, they're not efficacious, or they don't work. And all that comes to a head when someone gets really sick with this and they're struggling to breathe, and all that goes out the window, and they realize that it's too late at this point. And so when you have patients that come in and saying, I wish I gotten a vaccine, or even wanted to get the vaccine, when you see them by the time it's way too late, then the families, just dealing with their loved one who wasn't vaccinated being critically ill now, that's added a whole new flavor to the pandemic, a whole new layer of regret and sorrow, because people now know that this is preventable. So it's been, it's always been tough, but it's even tougher now because so many people are dealing with that regret by the time they come to see someone like myself.
yeah. Let's talk a little bit though about these vaccines. You're right, there is a lot of misinformation. We're out on the streets a lot and here talking directly to people, and they're just spewing the things they're hearing and seeing on social media. But I think we really haven't done a great job helping people understand what these vaccines are doing and how they're keeping people out of the hospital. I also think we we do probably a poor job just helping people understand. Sure, vaccines will have side effects. Like nothing is perfect, but it's so much better to be vaccinated than to take your chances. So help us understand the value of these vaccines.
That's so true. And I think one thing that gets lost in discussing the vaccine and whether someone's going to take it, or when are children going to be available to use it, when we're getting full approval, all of this conversation, we kind of lose the fact that the vaccines are a remarkable achievement. I mean, we had a pandemic that had killed millions of people, and on the backs of scientists at the FDA and the CDC and other places around the country, including people like Kizzy Corbett, we were able to produce a vaccine that keeps you out of the hospital. They performed at a level far above what we would have accepted or even been happy with. And I remember seeing when the first Pfizer studies came out, I was like, all right, it can't be this good.
Mhm.
Then it was backed up by the Moderna study. The Johnson Came out and worked really well. And we've seen over time, millions of people have now gotten vaccinated. They are staying out of the hospital. Now, there's a lot of talk about the vaccine effectiveness going down, and that means people getting symptomatic disease. And it's not unexpected to see some of those antibody levels go down, but people are still staying out of the hospital. And that is a big deal. I have not yet taken care of a fully vaccinated person in the ICU since the vaccines have rolled out.
What? Say that again.
So since the vaccines have rolled out, I have not taken care of a fully vaccinated person in the ICU. It's all vaccinated for me, everyone, every single person. So that's how powerful it is to really turn the tide on the pandemic. And when you're seeing so many people now who are so sick, and of course, our older population, they are heavily vaccinated. They're in the mid to high 80s or so, and same in my community. So we're not seeing those people in the hospital. We're seeing younger people. All these younger people are unvaccinated. So
how young?
I'm seeing 30s, 40s, 50s, and 60s.
Yeah.
As we get to the 70s and 80s, it's up there. But younger people, pregnant women, folks with young children, it's the goodbyes and the sadness is just that much compounded when you have a young person who has maybe a young family. They've got a lot of relatives who are worried about them. Everyone, is hoping and praying that they pull through, but not everyone does, unfortunately. I think if people could understand and see what we're seeing as healthcare workers, they would run to get the vaccine, just, run with their arm out, like, put this in me right now. And that's what we're trying to get across to people, that, you do want to have a conversation with your physician if you have any of these special sort of situations. But for the vast majority of people, you need to take this to protect yourself.
Mm-hmm. Just today, I escorted someone, a healthcare worker, to a vaccination site because she was afraid. And while we were waiting after her vaccination, you have to wait the 15-minute period to make sure you don't have a reaction. I asked her, I said, well, what is it that made you so afraid to get this vaccine? And she said, it's mostly just what I was hearing, like people were scaring me. And, I think we really have to figure out how to provide that kind of support to people in the community to get them vaccinated. Do you have any suggestions for us? So for those of us who are out in the community, we want to avoid you having to see these people. What should we be doing?
Everyone responds to the message differently. I had a friend who reached out to me, my friend from childhood, and he was in line actually to get vaccinated. He was about to lead the line because he started to get nervous. And luckily he reached out to me and texted me and said, let's be real. Like, we go back. What's your feeling on the vaccine? And I told him, honestly, if I could sneak into your house and jab you with the vaccine myself, I'd take the assault charge and I would feel very good about that. Because if someone saves you from drowning, you're not going to get mad at them because they scratched your arm, right? When we're trying to save people's lives, we really have to get that message across that what's good enough for me and my family is good enough for you and your family. So I talk about the stories. I talk about the people who've regretted getting vaccinated. I've talked about folks in my family who were resistant, and I finally got them over the hump and what they were concerned about. And fundamentally, it boils down to trust, because there is a lack of trust in the healthcare system, and that is an earned mistrust. But when we're talking about something that's taken so many Black lives at such a higher rate, we need people who look like us in the community saying, yes, I hear the issues that you're voicing and I understand them, and some of those are not going to go away. But when it comes to this vaccine, this is not the time to have those thoughts or reservations. We've seen over and over how powerful these vaccines are and what they've been doing for people. And this is what you need to do for yourself to keep yourself healthy.
Yeah. Well, this was meant to be a short interview, but I really just have one more question, one more thing for you to weigh in on, and it is the 20-somethings who tell me, well, I don't need a vaccine. I'm healthy. I drink my sea moss. I take my vitamins. I don't need to be vaccinated. I suspect some of these people are bringing coronavirus to some of the folks you're seeing in the ICU. What would you say to young people to pierce their hearts and have them really recognize that they're part of the solution too. We need them to participate in helping us in the pandemic.
Yeah, this is a moment where we all need to do our part to really protect each other. And I've seen plenty of people who've been young, healthy, did all the right things. I took care of a marathon runner for God's sake, did all the right things, and they still got very sick. And so we can't rely on just the fact that we live healthy lives to protect us. When I was young, I was growing up in a neighborhood where there were a couple of break-ins every now and then, and I had some neighbors who bought this really fancy alarm system with all the bells and whistles, and they got robbed. And they got robbed because they left the front door open. And so, you can do these things like keep yourself healthy, exercise, eat your vitamins, take those. I do that too. That's like building up your security system. You want a good immune system, but you need to lock the door to the pandemic. And the vaccine is really how you lock that door. And so it's, despite everything else that you're doing, you need to really shut the door and not let the virus in. And vaccination is really the way to do that.
I love the metaphor. Metaphors are so powerful. So we need to lock the door. Love it. Any last words before I let you go?
I think I just came from the ICU where we had a patient who is one of the sickest people I've ever seen in my lives. She's in her 40s. She was unvaccinated, didn't think that she needed to. And now she's hooked up to a breathing machine. Her lungs are still so ravaged that we have a bypass machine that's putting oxygen into her blood. Then her blood goes back into her body. It gets sucked out again because her kidneys don't work. So it's going through a kidney machine to clean her blood. And it comes back in, and she's got tubes in her chest cavity, in her neck, in her groin. There are 14 or 15 different devices inside of her that she was not born with that have all happened because of this virus. And she's fighting for her life with a young family who's wondering, what's going to happen with her. And this is what we're facing. Luckily, these sorts of severe cases are not as common with the vaccine out there, but it's really preying on people who don't have that protection. So you really need to protect your house. Don't say it can't happen to you. You want to make sure that you have yourself protected.
Wonderful. Well, thanks so much for being here. I certainly hope you come back, and we would love to bring some community people onto our next conversation so that you can talk to them directly and help them understand the seriousness of the situation. Right. So thanks for everything you're doing, Dr. Bell, and we'll see you next time.
Thank you. You have a good day.